All right, we're going to start the lymphatics now. So we've done the neck. We're going to come down to make sure we do the underarms. So for this, the positioning is important, okay? So making sure your arm is kind of a 90-degree angle, relaxed is important, okay? If that doesn't feel comfortable, you can bring it out or you can bring it down, but the whole idea is to leave openness in your underarm. To me, the most comfortable is in 90-degree, no matter what position. But this is going to be dependent on you. So
there's some strain through here. I'm a little.
So then how about that? Is that better?
Kind of in between.
Yeah.
It's a little random, but maybe.
How about there?
There we go. Yeah.
Okay. See, this is important. Position for your body is important. It does not about what the practitioner is doing. It's about what's comfortable to you. All the practitioner needs to be able to get to is to the lymphatic area. Now, ideally, like I said, positioning is 90-degree, but it is up to you. So do not be restricted by what the practitioner says, okay? So very good. Okay, so we start at the neck here. So we're going to make sure first, let's make sure that the lymphatic is open. Because the key thing for this area, because where we're bringing is from the chest.
Mm-hmm. So
we want to be sure that there is no strain. So I'm going to just kind of make sure, and we're just kind of checking the hole there at your underarm pit, that it's clear.
Fun underarm.
Underarm is always the fun part. Here, we'll let her look. Here we go. And blessing for her that I don't feel like there's blockages. You kind of know, because you'll feel hardness. You'll feel the popping.
Mm-hmm.
Pretty clear, which says good things about here. You know, it's kind of crazy, but a lot of people who have problems in this area have more bad body odor than others. Like, you'll know.
Mm-hmm.
So when this is not clear, you stink worse than normal. I hate to say that, but that's just the way it is, okay? So I'm going to start now. So we start from kind of the chest, and we just simply move. And we come under the breast. And so I'm doing 4 fingers, both, so that I can bring both under the arms. We're going to do 6 times. And when you're doing it yourself, because you're only doing this one hand, yep, we're going under, and then over.
And alternate between the two?
Yes. I think it's just because, I'll be honest with you, this is the most painful part for most females, is this. The more fat or tissue that you have in this upper area, the more painful it's going to be. Mm-hmm. And so for women, some upper is worse, some lower is worse. So by taking and alternating the 6 to 10 times the top from the bottom, you're giving yourself a break. Because potentially, and I'm not saying you're going to feel pain, but it's just more likely because of the spots you may feel.
There is tender. I'm always a little pretty tender right in here on the rib.
And most women are. Mm-hmm. So if you're the kind of woman, when you get your mammogram, and you end up always having to be like me and some of us women that have to go to that next level every single time, but you have to go through this is how you can already know your body, because you'll feel it. I promise you, you will feel something different. What does it feel like?
My arm needs a break.
Yeah, so here, okay. Why don't we put like this, right? Is that too much? Just separating that much?
No.
All right, but how about this?
That's very nice.
Okay, because see, we still opened up, so I'm just going to kind of turn a little bit so you all can see. We turned her elbow. This is another variation. We always have variations for us, right?
Yes.
Like we need them, right? So the elbow being out, but still, I still can get to this lymph node. You all can see that. That's okay. Leaves her hand, gives her the support of the elbow. Those who have had surgery in the elbow and shoulder can understand. Take a deep breath and blow out some. There we go. You do not want to be stressed like this. Now, so one thing is, if you do feel anything, like just a little tightness, tiny, with fingertip only, circles. And then we move to the underarm. Because this is how you can kind of check yourself. A lot of us with hypermobility issues, in the thoracic area tight. We tighten because we come and draw in. A lot of you sitting at a workstation, at a computer, you draw in. Those of you who are working, I don't know, massage therapist, lymphatic, you're drawing in. Those who do athletics, you tend to draw in, which means this area of your thoracic tightens. How do you counteract that? Well, you have to loosen it. You have to make sure you're hydrating appropriately and doing lymphatics to associate.
And I have a big point there, because a lot of physical therapists will just stretch you.
Yep.
And that is, when we just do it because we think, of course, they know, but you cannot stretch those. Your muscle isn't short. It's immobile, if that makes sense. And when you stretch something that's immobile, it tears.
Mm-hmm.
So mobilization, getting the fluids into the layers of fascia, unblocking the lymph, all of these things will improve mobility and relieve tension without any single stretch.
Right. We're not trying to move the muscle, the tendon, the ligament.
I'm sorry I keep shivering on you. I think I'm cold. My circulation is
Well, hold on. We're
responding.
going to fix that. We're going to have to help her.
More communication. You never know while she's out grabbing stuff. You're moving through, and this is impacting the immune system too. So other things, staying in comfort. Yeah, don't if I stop shivering on you.
And warming. and here's the thing. I mean, it is important, right? Because you shouldn't need to feel uncomfortable, okay? This is not about uncomfortable. Now, I won't say that you won't feel some pain with lymphatics, especially in this area, because for females and some males, it just depends, this is the most sensitive area of the body.
Mm-hmm.
Because of the draw-in and because of the sensitive nature of the area of the body. Pretty much your torso, from this area of the breast down to your pelvic area, is the most sensitive area of the body, besides behind the knees. We'll get there. You'll learn. So I'm going to continue to kind of move this while she's a little bit warm. And again, I found a tiny little spot, so I'm just very tiny little circles. 3, 4, 5.
Ooh.
And then we're going to move.
And that was so light, but I can feel it. Feels like a tiny little bump. It's got the little nodes, lymph nodes in there.
So a lot of times in the area of the chest and breast area, it's fatty tissue or fibroid or fluid buildup. There's usually 3 or 4 different things that's going on. But it literally, again, fingertip, it doesn't take much pressure. Tiny. Because it's enough. It's pain enough to just, those of us who have issues already with our skin, our muscles, our bodies, we feel everything. So it doesn't take much. And we don't want to cause pain. We just want to move the fluid, because where fluid is trapped, that's what creates a fibroid cyst, a buildup of tissue. So I'm going to continue. 7, 8, 9, and 10. And then we'll go underneath. And I can feel her relaxing already by getting her warm and letting her speak her mind. She's more comfortable. It's important that you feel that way too. Now I'm going to go around and do the other side, because of course, again, equality on both sides of the body, just like you do both sides of the neck, both sides of the head. It is important to do both sides of the chest. So we're going to let that arm be comfortable. We'll cover that one up. We're going to open up. And since we know already with her situation, I'm going to put her elbow up a little bit and put her arm down. As you can see, same what we did on the other side. And I'm going to first open up the lymph node. We'll just make sure. Now you might find as yourself, just like with me and most people, you may have one side worse than the other. And so as you're working, and you'll feel like a popping, like I said, or you feel a knot, or you'll feel something. Or if you feel nothing, great. If you feel sweat, boom, if you feel nothing but that butt liquid already, it's probably pretty open. Then when we go to move fluid into it, there should be no issue about blockage in any way. Okay, so we're going to start the same thing. And I'm going to start both. 4 of the fingers up and below to bring in the lymph node. And come around the chest. 3. And you can feel by doing this anything that may be going on in the body around this area. 5, 6. Okay, I'm just going to come back. And I felt just a little bit right here.
Ooh,
And she feels it too.
that one flares up at a certain time of the month.
And be honest, that's one thing about lymph nodes for most women in the areas of the breast and the areas of the pelvic area will flare up when you're ovulating. It's amazing. This is what he designed, though. That's the way it was designed. Your body was designed that, and the reason is, it's a message. It's telling you that your body's preparing, and you have to prepare with it.
And a little bit on that, 'cause I know you have some experience with this, and been chatting with some people who are, in the process of possible cancer diagnoses or recovering from with surgeries. What is the benefit of this for even more relating it to hormonal cycles and breast tissue and that concern? What is the lymph work here doing for like body in the future if I'm preparing or to help with any of those issues if I'm living with them?
The amazing thing about the lymph work is that it actually, if you think about it, your lymphatic system is the fight part of your system. It's what's, it has the white blood cells. It has the fuel to fight cancer, a cut, inflammation, fluid that is trapped, a cyst that may create, if you get injured, immediately a bruise, the white blood cells and the lymphatic part of the system immediately is what goes into action to fight, because it says, wait a minute, I got to help the body. You're reacting. You get pain, your lymphatic system goes to fight. By keeping the fluid clear and it allowed with no blockages or obstruction, then the white blood cells can go fight like they're supposed to, fully, with every amount of protein, energy, and fuel that you've given it to fight. So it is very important to keep your lymphatic system clear, especially when you are experiencing any sort of issues that may result later in life, or an injury, or cancer, or even pregnancy is one that people don't realize, but pregnancy, your body does crazy things. And if you have a clear lymphatic system, imagine the fuel that you're already intaking more for another being that's inside your body can flow through your body to them. So you keeping your system clear allows for better fuel for yourself and for them. Okay, we're going to come down the body. And we're going to come, so the next, we talked about, again, we started at the top of the head, brought it to your ear, lymphatic. We made it to the first major lymphatic drainage, which is at the throat here. Underarms is also a major lymphatic drainage. We're going to now come to the major lymphatic, which is in your pelvic. This is the most major. This is the one that, besides swallowing, which is the large one, right, like in your throat, the pelvic, you pee. This is your bladder.
Let's do her in the next video.